thank you so much for joining us today for using multi-tiered systems of support to address students' mental health and evidence-based approach. At this time, I would like to introduce Dr. Jessica Bailey, who will be moderating today's webinar.
Thank you so much, Shanna. Hi, everybody. I'm Jessica Bailey. I am the Partnerships Lead for the REL Northeast and Island program. Go ahead to the next slide. So our agenda today includes just doing some quick introductions. Then we're going to dive into discussing mental health in K-12 schools and why this is an important issue right now. We're going to then talk about research behind the multi-tiered systems of support and using it for mental health. Then we'll talk a little bit about selecting evidence-based MTSS or multi-tiered systems of support interventions. We will have time for Q&A at the end, so please do be sure to put your questions in the Q&A chat, and then we will answer them at the end. And then we will wrap up. We have a survey at the end for you. We also are going to be mentioning a community of practice that will be starting, so please stay on for that. And just as a reminder, all of this will be recorded. If you have to hop off early, the recording will be sent out to you along with the slides from today. I love seeing where everyone is joining from. We have people from all across the country, including the Virgin Islands. We have folks from my neck of the woods in Vermont. Love seeing that. Thank you so much for introducing yourselves. Next. We have a couple goals for today. We want to provide you with an overview of the multi-tiered system of support framework, just in general, introducing that to you, but then also describing a process for identifying and implementing evidence-based mental health supports through MTSS. So that's kind of a different spin on using MTSS. But first, let's start out with some introductions. So thanks again for putting your name in the chat and where you're from. Next, please. And we can introduce who we are. So if you joined us in the lobby, you would have heard that we are representing the REL Northeast and Islands. We are one of 10 regional educational laboratories. We are funded by the Institute of Education Sciences, which is an arm of the U.S. Department of Education. We are tasked with working in partnership with educators and policymakers to develop and use research that improves outcomes for students. We do this by conducting research studies, disseminating research findings either from our own research or others. We strategically engage with our partners to use the findings, and we also design and deliver technical assistance focused on the use of data and research. We also host great events like this one today. Next. So today's presenter, the main presenter is Dr. Shai Fuchsman. He's a senior research scientist at the Education Development Center and representing the REL Northeast and Islands today. Shai has extensive experience in social and emotional learning, school-based trauma-informed care, and substance misuse prevention. He currently leads the Massachusetts SEL and Mental Health Academy, where he provides training and coaching to help Massachusetts schools and districts promote students' SEL and mental health well-being using a multi-tiered system of support approach. Dr. Fuchsman holds a master's and doctorate degree in human development and psychology from Harvard University. And again, I am Dr. Jessica Bailey. I am the partnerships lead for the REL Northeast and Islands. I oversee all 9 of our partnerships in our region. So let's get started. Next. I'm going to turn it over to Dr. Shai Fuchsman in just a minute, and he's going to provide a bit of context about the current mental health landscape for students. But before I do that, I want to paint a picture for you of a fictional character who's struggling with her mental health. Although she is fictional, her situation is very realistic and relatable. Next. Okay, so let's imagine for a moment that this young woman in the middle is Sarah. Sarah is a student who enjoys art, playing with her siblings, and hanging out with her friends. She's an excellent student who works very hard and is involved in many extracurricular activities. She has never been in trouble in school, and she gets high grades in all of her classes. However, within the span of a few weeks, Sarah has started falling asleep in class over multiple times. Recently, Sarah's grades also began to slip. And when her teacher asked her why her grades were slipping, Sarah broke out in tears. She mentioned that her parents recently separated and she has assumed more responsibility for her younger siblings. To manage all of her responsibilities, Sarah has been staying up late at night to complete her activities and finish her extensive amounts of homework. She has been struggling to manage her stress and has felt incredibly anxious. She recently experienced a panic attack while doing her homework, and although she is exhausted, she is often unable to sleep at night. Moreover, she has felt afraid to tell her parents about how she's feeling because she knows that they already have a lot of stress, and she doesn't want to tell her teacher for fear that she'll be treated differently or not seen as fully able. She's been dealing with all of this on her own. As you can imagine, Sarah's struggle is all too common among students. We'll return to Sarah at the end of today's webinar, but now I'm going to turn it over to my colleague Shai to explain the context for why we're focusing on mental health right now. Shai?
Great, thank you so much, Jess. So Jess just described Sarah, and as she said it, even though she's a fictional character, this could very well be a student who's going to be walking into your school or your district, in your community, in your state this fall. In fact, even though the circumstances might be different from student to student, there are literally millions of students who will be walking into your schools this fall with mental health challenges like Sarah. And I want to provide some data to go along with the story. So first of all, we know that the mental health crisis that we're facing did not start with the pandemic. It began before the pandemic. In fact, according to CDC data from 2019, before the pandemic even started, already was showing that 9% of students were diagnosed with anxiety. That's 5.8 million students. And over 4% of students were diagnosed with depression. That's about 2.7 million students across the country. And these are just the statistics for students with a mental health diagnosis. It does not count the number of students who have mental health challenges, who either simply haven't been diagnosed or don't quite reach the point of diagnoses. So we know that this is an issue that we've been struggling with for quite some time, the mental health crisis. We also know that the pandemic certainly exacerbated COVID exacerbated mental health issues, not only for students, but also for parents and educators. There are two silver linings, if we can call it that. Number one is that the prevalence of mental health challenges is now actually seen, and there's concern among educators and education leaders. This awareness has led to more screening and more diagnoses of students with mental health challenges, which is helping to truly uncover the true severity and prevalence of mental health challenges, as well as the inequities that exist in terms of mental health disorders, as well as access to mental health services by different racial, cultural, and other identity-based groups. The other silver lining is that there's more funding now than ever before going into from the federal government and from state agencies into districts and schools to address mental health. Some of it came through COVID relief funds like ESSER, and even more recently, some of the legislation to curb gun violence have also included mental health issues. So there's now an opportunity and a need for schools to really think about how do we address mental health in a systemic way. Next slide. Before I move on, I just want to share a little bit more data that is more recent, kind of in this current COVID reality. So according to more recent 2022 data from CDC, so same agency, but more recent data, more than 37% of high school students reported poor mental health during the pandemic. In addition, 44% were self-reporting symptoms associated with depression, such as being sad or hopeless, feeling sad or hopeless during the past year. And note that this is an increase from 2019 and 2009, same data source, I should say. And then also, alarmingly, 55% of students recently reported experiencing emotional or physical abuse by a parent or an adult. So trauma is definitely one of the drivers of this mental health crisis. I also mentioned inequities before. This same data source from CDC showed that LGBTQ students, girls, and Hispanic students were more likely than their peers to show symptoms associated with depression, as well as reporting attempting suicide. Next slide. Also, the National Center for Education Statistics, which is part of IES out of the US Department of Education, has been collecting data from schools about the impact of COVID on students. And one of two of the data points that they shared is 8 out of 10 public schools have indicated they've seen social and emotional development stunted by students during the pandemic. So just anecdotally, I just talked to someone from a school here in Massachusetts who said that the high school students, 9th grade, 10th grade students are showing up with a maturity level of 6th grade students because they haven't been in school for so long. And then in addition to that, 7 out of 10 schools reported an increase in number of students seeking mental health services. Now, chances are that all of us, or almost all of us in this virtual space today, are somehow connected in one way or another to at least one school, whether it's through our personal lives or our professional roles. And I'm sure that if you are connected to a school, none of this is surprising to you. This is just data that captures what we've all been observing through our own experiences. Next slide. So today's webinar is not about just talking about the problem. We do have a crisis. It's important to acknowledge it, to point it out, and to understand the magnitude in the different ways in which it's impacting our students. But the goal today really is to talk about how do we address this crisis, and specifically, how do we address the crisis through a research-based approach or framework that really creates a whole system of supports in each school. Next slide. So many of you are probably familiar with the concept of multi-tier system of support. Depends on who you ask. They might say it's either similar or the same thing as RTI, response intervention. You might know that term instead. And you might know it either in the context of mental health or in the academic or behavioral context. PBIS, another framework, uses the same kind of model, MTSS model. The basic tenets of MTSS are that you're providing different levels of support to different students based on need through these different tiers. Tier 1 is for all students, regardless of need, regardless of how they come into school. All students receive Tier 1. And that's basically what schools do best, right? Classroom-based curriculum, classroom-based practices, school-based practices, policies, all those things that impact all students. But then through the MTSS framework, we also have systems to identify students who need additional supports, who will receive more targeted levels of support. And again, all students receive Tier 1. Some will also receive more and more through Tier 2 and Tier 3. Tier 2 is mostly through small groups or other kinds of classroom-based or outside of classroom interventions that provide supports to students that for low and moderate need. And then Tier 3 is that more individualized and intensive one-on-one mental health supports. At EDC, at the Education Development Center, through our work with districts across the country, we've also identified what are some of the elements that make MTSS most successful, both from our own practice and directly from the research. And one of the things we've added is this foundation of supporting families and educators, especially in the context of mental health. Like I said before, COVID has exacerbated mental health, not only for students, but also for the adults in their lives. And that obviously impacts students as well. So by supporting parents, by supporting adult teachers, by making sure that we're focusing on adult well-being, we're not only helping the adults themselves, but also we're helping them to role model for students effective strategies for coping with stress, with emotions, and other stressors that can create mental health challenges. We've also identified, kind of boiled down, what are those binding elements? Because again, MTSS is more than just the 3 tiers. It's a system that works it's a cohesive system. And to have that cohesion, you need these 4 drivers of effectiveness. Starting with the vision and commitment from the leadership at the school level and the district level. Second, everything needs to be informed by data, from using data to inform what specific programs and practices you want to implement in your school at all 3 levels, to using data to identify who are the students who need additional supports, and using that same data to monitor their progress, to make sure the interventions work. So data is a kind of the fuel that makes this engine of MTSS work. Third, like in any education approach, effective implementation is key. If we're going to use evidence-based programs or practices, we need to make sure they're implemented effectively, and that includes monitoring for implementation, using continuous quality improvement to make corrections, find the balance between fidelity to the original program and adaptations as needed. Fourth, equity, and I want to elaborate what we mean by a focus on equity. When we talk about MTSS and why it's so important. I already talked about the inequities that exist when it comes to mental health. And a non-equity approach to mental health is to disregard the fact that some groups of students are struggling more with mental health and simply wait for those same students to struggle, whether it's through their behaviors, by slipping academically, by engaging substance misuse, and only then provide them with tier 2 or tier 3 supports. An equity approach is to better understand that certain groups are struggling more, and not only that, but asking why. Looking at what are those drivers of stress or of mental health challenges. For example, when LGBTQ students or students of color report that they don't feel a sense of belonging, that they don't feel that safe expressing themselves, expressing their identity, that's going to create mental health challenges. So instead of waiting for those same students to struggle and then support them, an equity approach means looking at that and saying we need a tier 1 approach to create a school culture that is welcoming to all students. And that will reduce the need for tier 2 and tier 3 students. So that's what we mean by equity, focus on equity. And lastly, communication coordination. We're talking about a full system where every adult in the school building has a role to play. From the general ed classroom, integrating social emotional practices in their instruction, to the school adjustment counselor who sees students individually or in groups. And not only everyone needs to be involved, but everyone needs to work together in a cooperative way. So even if a student sees a school adjustment counselor or a mental health counselor once a week, that student is still going to spend most of his or her time in the classroom. So how can the general ed teacher and the school adjustment counselor work together to support the whole child? Next slide. This is another way of thinking about MTSS from an SEL mental health lens. Specifically, tier 1 is that building of social emotional competencies, and I'll say more in a second about that, as well as mental health promotion. Just like we talk about focusing on physical health, not only when we're sick, but also when we're healthy, and especially when we're healthy, jogging, eating right. We also need to focus on our mental health, even when we are mentally healthy, by thinking about what are the ways in which we manage our stress, manage emotions. So that's tier 1. And then besides that, how do we identify students who need additional SEL mental health support? Next. And this is a way of thinking about how SEL mental health going to fit into an MTSS framework. Tier 1 is focuses more on SEL, but also, like I just mentioned, has positive mental health in also as part of tier 1. As you look at the higher needs students and those interventions to address those higher needs, they focus more on specifically mental health interventions, but also while thinking about how do we support these students' social emotional growth. Next slide. This is not just a framework that makes sense, but it also is backed by research. Multiple studies and meta studies have been coming out in the past several years to demonstrate how MTSS produces positive results when used to address mental health specifically. We chose 4 on the slides, on this slide, just to illustrate some of those studies. By the way, this slide deck, including the references to all 4 of these studies, are going to be shared with everyone who registered through your email. So you will have that. At the very end, you'll see the references to these studies if you want to take a closer look. But just in general, as you look through the slide, I won't read through them all, but you will see that different studies or meta studies or multiple studies have shown all kinds of different positive outcomes, including at the tier 1 level, students are increasing their social emotional competencies. So all students are demonstrating social emotional growth and improve academic. Many of these also find academic outcomes. So this is not an addition to academics. This is part of academics. When we help students develop these social emotional competencies, when we address mental health, we make sure that they are ready to learn, that they are better learners. And that is reflective in the academic outcomes that are measured as part of these studies. But also the symptoms of mental health challenges like depression and PTSD were reduced in many of these studies. And then also the school level and at the educator level, educators have felt more confident in being able to address their social emotional well-being and mental health, and schools have indicated that they feel they have a greater capacity to support students. So those are some of the outcomes from studies specifically looking at the use of MTSS to address mental health. Next slide. So I'm just going to go through the tiers and the other elements of MTSS for just a couple of minutes. So tier 1, again, is mostly about building social emotional learning. I know that SEL as a term is becoming much more popular, as is this framework that you see on the right side of your of the screen. It is developed by was developed by the Collaborative for Academic and Social Emotional Learning, CASEL. It's probably the most well-known SEL framework. And basically what CASEL did and what this framework represents is SEL is in essence the process by which we help students develop a whole host of different kinds of skills, attitudes, knowledge that will help them academically, that will help them make healthy decisions, improve their mental health, and also improve their readiness for college and career. And so what CASEL did is they took all those skills and put them into 5 different buckets. Bucket number 1, self-management, includes things like managing emotions, managing your behaviors, knowing how to manage behaviors and emotions to succeed with your goals. Self-awareness is being aware of what are your strengths, what should you feel good about yourself. Also, what are your challenges and how do you address those challenges? So for example, growth mindset, the concept of growth mindset falls under that bucket. Social awareness is about developing those skills that we need to be able to see other people's perspective and to feel empathy for others, and not just at the individual level, but also kind of more socially, understanding the world we live in, understanding what are how we impact our society, and what are the, how people kind of interact and how those interactions create positive or negative social dynamics. So that is an important set of skills, obviously, and so that's under social awareness. Relationship skills, including how to develop and maintain meaningful and healthy relationships, as well as other related skills, including conflict resolution. And lastly, responsible decision-making. How do I make ethical and productive decisions in my life and the lives of the people around me? Now, there's different ways of teaching or helping students develop SEL, social emotional competencies, whether it's a standalone curriculum where you actually teach, like second step or life skills, or whether it's classroom-based practices, integrating social emotional practices into academic instruction, promoting collaboration for relationship skills in your math class or your science class, reading about or understanding the emotions and how emotions impact students through reading books, through the characters in the book, or school-based practices, making sure that every student is greeted at the door when they come in. Regardless of what those approaches are, what those programs and practices are, there's a couple of key principles. Number 1, you have to be thinking about it as a school system. You want to be thinking about it intentionally, not just saying, well, our teachers generally do these things. Some of them are really good at it, others not so much. That's not good enough. It has to be intentional and it has to be systemic. We're all going to focus on using certain practices to help our students develop social emotional development. We're going to integrate that into the way we do artwork. And also implement it consistently and well. Again, whether we're talking about program or that we're talking about a classroom-based practice. And that it's vertically and horizontally aligned. Just like math, just like literacy, we can actually look from a research perspective on the developmental benchmarks that students need to develop these skills. What a kindergartner needs to be able to do in kindergarten is different from the skill level at the middle school level or the high school level. But we need to make sure that we have a K through 12 or even preschool to 12 approach to building these competencies. And obviously that they're also horizontally aligned across all schools, for example, all elementary schools. Next slide. Before we turn to tier 2 and tier 3, I want to pause here and say the other a really important part, what I consider the heart of MTSS, besides tier 1, is the process of identifying, placing, and monitoring students into tier 2 and tier 3 interventions. It's not good enough to just have the tier 2 and tier 3 interventions, even if they're the best interventions, the best practitioners. If you're not identifying and matching the students to the right intervention, that's not going to be helpful to the students. And so a couple of principles for how do we put in place a system to identify students. First of all, it's important that all adults in the building have a basic understanding of what are the mental health red flags or what are trauma-related red flags. We're not asking for every single person to become a mental health expert. That's not what this is about. But simply, what are those things that I might observe as an adult in the building that might make me think, I think there's something going on with Johnny or with Sarah. Let me talk to the school adjustment counselor. Let me have him or her have a conversation with the student. And we say all adults because obviously classroom teachers see students most of the time, they're the ones who see the students the most in the classroom. But sometimes the symptoms of mental health challenges might not necessarily come across in the classroom. You might have a student who's, for example, shy or usually disengaged in the classroom, doesn't like to participate. And so you might not see it different in their behavior after experiencing a traumatic event. But maybe that same student is an athlete who is really active and engaged during football practice or soccer practice. And all of a sudden, that person is disengaged. And the coach is the one, the athletic coach is the one who's able to observe that and notice that. So it's not always, so we need to make sure everyone is kind of has eyes and thinking about these things. And then not only knowing what the red flags are, but also who at the school to refer the student to if you think that there's something going on. You're not diagnosing, you're not immediately putting a label on the student, you're simply raising a red flag and have someone else take a look. And then the next step, obviously, is using a mental health screener by someone who's trained to screen students for mental health to identify if, in fact, there's something going on. But also, schools more and more are using universal mental health screeners, where all students once a year, twice a year are screened for mental health issues. Usually they're very quick and protocols to screen students. And then if they are in fact identified as potentially having mental health crisis, through that screener, we'll have additional conversations and additional screeners. Not only do you need to have the processes for identifying students, but you also then need to be prepared to support the students. So simply knowing that you have 20% of your students are struggling with anxiety through a screening process isn't really helpful if you're not prepared to support those same students. And for that, and I'll talk more about it in a second later on, but for that, you also need, one thing that is helpful is building building collaboration, community-based health agencies that can help you with all these mental health issues that, again, are traditionally not what educators do. It's not what schools do. So having additional support from outside mental health people, whether it's helping to screen, whether it's having a referral process, that collaboration is important. Next slide. And then not only do you need to identify students, but then you need a process for figuring out how to place and monitor students. So this is a diagram of a way of doing it. You have the initial referral, maybe the coach, maybe the teacher, the librarian notices something, brings up the school adjustment counselor. Usually there's additional data, whether using a screening tool or maybe just having a conversation with a student, having a conversation with a parent, just trying to figure out what's going on. And then bringing that data, understanding how the student's struggling, what's going on, and developing a plan that refers the student to tier 2 and or tier 3 intervention. And then after that, every few weeks, monitoring progress and seeing is this actually making a difference. And it's important for me to also include that communication with parents and teachers. I mentioned before that an important aspect of making MTSS work well is an ongoing collaboration. One of the things that I've heard from teachers is that in their schools, they have a referral process for students to get seen by a school adjustment counselor, but oftentimes there isn't that communication back to the teacher. So the teacher doesn't know what happened to the student. They don't know if the student is being seen or what kind of support they're receiving outside of the classroom. And even more importantly, they might not know how they can support the student when the student is back in their classroom. So that communication with parents and teachers as appropriate, when appropriate, you don't want to divulge any confidential data, but to at least have that conversation with parents and teachers so that you're all really working as a team. Next slide. So this is an example of a school here in Worcester, Massachusetts, where I live in the state that I live in. And this is their diagram. This is kind of their process, their flow chart that they came up with. So in their case, they had a specific protocol for any acute event. A child just lost their parent, or a loved one. You're not going to wait for a meeting, that is a week from now or 2 weeks from now. There's an acute concern meeting right away, the same day, and there's a plan developed right away to address students' needs right away. So they have a specific protocol for an acute event. And then they have all these different processes and referrals into what's called a student support team. I know other districts call them a whole child team, a child study team, a building-based team. But it's basically a team that meets once a week or every couple of weeks receives all these referrals, looks at the data, and develops a plan for tier 1, tier 2, and tier 3 support. And they receive data from the assessment. So maybe there's an SEL assessment that shows student strengths and can also identify weaknesses, or it's a staff referral. Maybe when parents or caregivers call, that all goes into student support team. And then with students, they had them go through the guidance counselor. So that's kind of the flow chart and different protocols for how to take different pieces of information, ultimately to make sure every student is well supported. Next slide. Tier 2, as I said, just a few examples. They can be additional support that the classroom teacher provides in the classroom for a specific practice. Maybe you're teaching the SEL curriculum, so a few students you might work with it. You can spend more time on that practice. Or Zenden, the concept of Zenden, or a quiet corner in the classroom where some students can go when they feel dysregulated. Could be an outside group mental health support outside the classroom, group support by a mental health counselor, or even outside of the school. Mentoring, one-on-one mentoring, is also tier 2. It's not considered an intensive one-on-one tier 3 intervention. Small group social skills like lunch bunch, for example, where kids who are struggling with social skills get together during lunch and have lunch together. Or family engagement. That's another way of adding additional support for some students who might be struggling. Next slide. And then there's tier 3, those individualized interventions. And a couple of things to keep in mind. These are for students, particularly those who are diagnosed with a mental health disorder. Usually it involves screening a student, not just the universal mental health screening tool, but really trying to understand the specific diagnosis, the specific disorder, what's behind it. So it really becomes very, very intensive, and also often requires partnership with mental health agencies. As you can see, MTSS is a triangle. In theory, only a few students are going to get to that tier 3 point where you only have a few mental health staff who can work with them individually. However, as we're seeing mental health needs increase, this triangle, to be honest, is starting to look more like a trapezoid or whatever that shape is. It's the tier 2 and tier 3 are kind of expanding. And many schools just don't have the staffing for it. That's where the mental health, the collaboration with mental health agencies or hospitals who are designed to work clinically with students or individuals one-on-one can really be helpful. They could also be helpful in running small groups in the agency, and perhaps also providing additional support to staff through tier 1. But really, it's that tier 3 that those partnerships can really be helpful with. Next slide. And just a couple more words about partnerships. It's some of the things that are helpful to ways of having these partnerships is establishing referral processes. So whatever your process is for identifying students, that there is that kind of channel towards a community-based mental health provider if your staffing doesn't allow for support in the school, or maybe additional in addition to the whatever support they're getting in the school. They can provide support either outside or inside the school. So a lot of outside mental health providers have contracts or agreements with the schools where they come in and provide services to the individual students in the school, but paid for the parents' insurance or Medicare. So it's basically just a logistical solution. Instead of having parents taking the child to an outside mental health clinic outside of school hours, it just happens with the parents' permission, obviously, in the school. During the pandemic, more and more states and more professional organizations allow for telehealth. I'm not sure where that's standing. Some maybe we're reverting back to not allowing telehealth, but to the extent that telehealth is another important way of ensuring that your students in your school have that referral to an outside support. Also, in terms of partnerships, it's important in order to strengthen those partnerships, for school representatives to sit on community coalitions, those substance misuse prevention coalitions, suicide prevention coalitions, in order to really help and be part of these. Sorry, got distracted by a message. To make sure that you're part of those efforts. Next slide. A lot of districts ask us, so where do we get started? We spend months working with districts on building MTSS frameworks, so I'm literally running out of time. So I'm not going to go through the whole process, but the very first step is just to do an inventory. because a lot of districts already have some tier 1, some tier 2, some tier 3, some systems in place. It's really about figuring out first, what do you have, what's already established, doing that inventory, and then establishing what is missing, what are the additional pieces that we need to add. And also, what are the systems that are either there or not? You know, do we have the data that we need? Do we have the leadership's commitment and vision? So kind of figuring out where you're at and then moving towards an action plan to building that system. And because we are talking about a system, it's not just about having all the pieces, but it's also about putting the pieces together. I like to use the IKEA metaphor. When you buy a piece of furniture at IKEA or another furniture store, oftentimes it comes in a box. You have all the pieces in the box, but you don't have furniture because it's just pieces. And so you then need to go and assemble the furniture. Same thing with MTSS. You have to have the pieces and then assemble a system. Next slide. So we've talked about what is MTSS, what are the different elements of MTSS, what makes MTSS effective to address mental health. And now we want to talk segueing from the last piece, how do you select evidence-based interventions, specific interventions into your MTSS framework? So how do you bring all those pieces into the mix? Next slide. So I had the privilege to work with a group. This webinar is from REL Northeast and Islands. I worked with a group from the REL Appalachia, one of the other regional RELs run by SRI International. And it was specifically focusing on how can schools address trauma. And we came up with this really helpful, quick handout that provides a process for assessing student needs, mental health needs, examining your current resources and capacities, and then selecting the right interventions. So I'm going to, and you'll have this link. You'll see the link in the bottom. When you get the slide deck, you can click on that link and you'll see the whole handout. It's a really helpful handout, if I may say myself. So let me go through that process very quickly. So next slide. So first, assessing your student needs. There are different ways in which you can assess student needs. The kinds of questions you want to ask when assessing needs are, what are the specific mental health challenges? Is it anxiety? Is it depression? Is it behavioral issues that students are facing? What are the stressors contributing to the challenges? So what is underlying those mental health issues? In public health, we call those the risk factors that lead to behavioral mental health challenges. But also, how do those challenges manifested? Is it through disruptive behavior? Is it through an increase in substance misuse? Is it through suicidal ideation? So kind of understanding but not only the mental health challenges, what's driving them, and how is that impacting students. And this handout is now in the chat too. And these are just 4 different kinds of data that you might have. So qualitative findings, conversations with parents, with students, with educators to better understand the picture. Survey-based assessments. So for example, an SEL assessment like Panorama or DESA, student records, absenteeism, and then aggregate behavioral psychosocial data, disciplinary data, that all that data that you already have might help you paint the picture and answer these 3 questions. Next, you want to examine what are your capacities and resources to implement an intervention at any of the 3 tiers. So first of all, what are the current, like I said before, what are the current needs, and what are the ways in which we currently address those needs, and what are the ways we're not? What's the missing pieces that we need to add? What are the resources that you have to implement something new? For example, do you have the right training? The staff have the right training? Do you have the people who have the right licenses to practice certain types of interventions? And also, do you have the funding? So those are kind of the resources questions. And also, if you don't have the resources yourself, what can community partners bring into the table? So maybe you don't have the staff to run tier 2 interventions. Maybe the mental health provider in the community can run them for you. So then lastly, selecting the right intervention. You want to make sure that you match the interventions to the student needs. You also want to make sure that you're able to implement it. You have the resources, you have the capacity to implement interventions, and that you're using interventions that are most likely to work. And by that, we mean evidence-based interventions or interventions that have been studied and evaluated and show effectiveness. Next slide. So here's a list of different evidence-based interventions. I'll just mention the first one is part of that same REL Appalachia handout. It was a companion to that handout where we did a literature review and looked at evidence-based trauma-informed programs. The other ones are mostly either federal agencies in their list of evidence-based programs, like the What Works Clearinghouse from IES, or other organizations like AR and CASEL. Next. And then we also have some tools as resources to help you, to guide you through the process of identifying the right program that works for you. So the Hexagon is a great tool from the National Implementation Research Network that walks you through the different questions to ask in order to get to the right program. I'm also going to skip to the bottom, the last two, the SHAPE from the National Center for School Mental Health, and SAMHSA, which is the federal agency oversees substance abuse and mental health services. They both have tools and processes for helping you select the right mental health screening tool. So if you're specifically looking for mental health screening tools, those are the two resources you want to take a look at. Next. So with that, I hope this was helpful in better understanding MTSS, how it's used for mental health, and how you can build your MTSS framework. And with that, I'm going to turn things back to Jess.
Thank you, Shai. That was really informative and wonderful. And you've got a lot of questions coming your way. So we'll turn to those in just a minute, but I'd like to turn back to Sarah. So I painted a portrait of her before we began all of this content delivery, and she was really struggling in school. She was dealing with some home life issues, and now let's turn back to her. So Sarah's teacher was concerned that Sarah's grades were slipping and she was disengaged in class. So after Sarah broke down in tears when her teacher asked her about her grades, the teacher decided to refer Sarah to the school's SEL mental health student support team. The student support team convened a meeting with Sarah's teacher. Prior to that meeting, the student support team coordinator reached out to Sarah's mother and asked her some questions about Sarah's home life to get a better sense of what might be troubling Sarah. The team decided that Sarah would benefit from seeing the school's school adjustment counselor once a week for several weeks, and that's a tier 3 intervention since that's an individual. The school adjustment coordinator administered anxiety and depression screenings and was able to diagnose Sarah with a mild anxiety disorder. She communicated this to her parents and helped refer Sarah to an outside clinician for support, another tier 3 intervention. In addition, the school began a series of small groups for students struggling with stress management. The group meets twice a week after school for 8 weeks and focuses on helping students develop mindfulness meditation practices and other strategies for coping with stress. Sarah was invited to join the group, and that would be a tier 2 intervention. Finally, her teacher offered to check in with Sarah every morning for just a few minutes to see how things are going and offer her any help that she needs with her academics. Sarah took her up on this offer, including coming to meet with the teacher during her free period to go over some of the content that she found especially hard. And over time, through these various supports, Sarah became more resilient and better equipped to manage stress, even while navigating academic and family-related challenges. So I hope that this vignette has given you a feel for how MTSS could be used to support student mental health. And now I'd like to turn to the Q&A. And great, so now you can see myself and Shai. We have a whole host of questions that have been coming in. I think we'll kind of go in order. Unless Shai, if you wanted if you want to jump in on any. Okay,
no, that sounds
so
good.
we'll just go in order on some of them. So if we think back to slide, one of the slides where you were showing the MTSS framework, and you presented some of the drivers below that framework, and maybe Pradipti, if you want to bring up slide 13 for everybody. The question was about, can you just share a little bit more about how these drivers were identified and they're different from the model that this person was most familiar with?
Yeah, so obviously there's a lot of research going into MTSS. At EDC, we've done our own research. And so that's what we identified. And by our own research, we're talking about 2 different types of research. We did a literature review and kind of identify what were the elements that we found from the different research studies. But then also we've been doing our own work in helping districts to implement MTSS frameworks. So we identified these as specifically being the the drivers that make MTSS, make the system work best. Kind of what are the needs that make the system work? When you don't have leadership, for example, we hear from a lot of individuals in schools saying, I just don't have the buy-in from my colleagues. I can't really have an MTSS framework. I can't have a team working on this because no one wants to be part of my team. When you don't have the data, it's difficult to identify interventions. And I can go on and on with the other three as well. The idea is these were the both from the literature and from our own work, the drivers that we identified as being needed in order to make the system work.
Great, thank you so much.
Oh, I'll just add, I mean, there probably are other frameworks and other drivers. So this is, I think they're all helpful.
Yeah, that's wonderful. Thank you, Shai. So another question came in about refugee children, and is there data related mental health status for K-12 refugee children? I know you rattled off a lot of statistics in the beginning. Do you know of anything offhand for refugee children?
I definitely know that there's been a lot of research on that topic, and refugee populations are definitely considered to be among the most vulnerable populations when it comes to mental health. Unfortunately, they're also among the most vulnerable when it comes to access to mental health services for all kinds of, and there's all kinds of barriers for them accessing mental health services. I can't point out the specific articles right now, but they're definitely out there, and that's definitely a population to keep in mind.
Great, and just a note, you will get the slides emailed to you and the recording, and our contact information is in the slides towards the end. So if you do need to follow up with Shai about a topic like this, feel free.
Yeah, happy to do so.
Thanks. There was a couple of questions that came in about, do you have like some screeners that we could use? What are some examples? I believe that you showed some of those on a few slides ago. Anything else that you want to say about screeners?
Yeah, so to build on your point, if you go to that slide, let me see what that slide is. That SHAPE
17
resource, so slide 29, the second to last resource. SHAPE not only has a process for identifying mental health screeners, but they also have a library of mental health screeners that have been tested for different psychometric properties. And you can actually filter all the different kinds of mental health screeners by grade level, by how the administration process, whether it's teacher rated, student self-reported. So there's all kinds of them. And I would definitely encourage looking at SHAPE. And also the SAMHSA one, the last bullet, it's a document, but it provides a lot of good questions and considerations for how to select the right one. So not only you can use the list that SHAPE offers, but then use the SAMHSA and the SHAPE system to figure out which one, how do you make the right decision about which screener would work, or a set of screeners would work for your school or for your district.
That's great, thanks, Shai. And there's another question that came up from Lori about, related to this topic, I'm going to jump to, about are there screeners that are sensitive to cultural, ethnic, or linguistic differences and how mental health challenges may manifest? And I'm concerned about over or under identification for different students.
Yeah, so first of all, that's definitely a concern, and it's definitely a consideration. You want to be thinking, when you're selecting your mental health screening tool or tools in your school, you want to make sure that they're tools that have been used and tested with the different populations that in your school. I believe that my sense is that more and more of the developers of these tools are now moving to testing these tools and refining these tools for cultural relevance. In fact, there's actually a resource from the Royal Northeastern Islands that was developed a couple of years ago that examined different, this was SEL assessments, which was actually kind of slightly different tools, but that indicated they rated all kinds of assessments on different, with different criteria, and culturally responsive tools was one of their criteria. So I think you'll find them. You do need to look for them. You do need to keep that in mind. But they are out there, and hopefully increasingly more and more of the tools are being tested with different populations.
Okay, great. Lots of questions about screeners. One more, and then I'm going to switch to some other topics. So, Christy was asking, do you have a sense of like the rate of false positives and false negatives on screeners?
Honestly, I don't. I think it's a great question. I'm wondering, when you identify screeners or a screener, a set of screeners, it's always good to look at the research behind the screening tool. So for example, SHAPE, and so there's actually a couple of other resources that do similar kinds of libraries of and kind of review different screeners. And they usually cite the studies that were used to develop the screening tool. And so I'm wondering if that information might be there.
Yeah, and someone, Helena just actually put in the chat that it's usually less than 5%, and she put in an article in there. So thank you. I love this like crowdsourcing of answers here. It's wonderful. Okay, so Steve asked a really good question earlier about how many district boards and leaders are hesitant to screen for mental health needs due to concerns regarding liability. And in identifying the problem, they're concerned that they must support services for that student. And how would you respond to a concern like that?
Yeah, it's interesting. Actually, I had a couple of colleagues write an article, and we can add those to the resources when we email them out, about the different barriers that schools are facing in addressing in using these kinds of mental health screening tools or youth health surveys, and what are some talking points to address those barriers. And the concern, I think what you said, Steve, that Steve brought up, is definitely one of them. Either it's liability, it's just not feeling like it's the school's role to be screening students, that, the focus of schools is just academic. So there's definitely a lot of arguments against using these kinds of screening tools, which obviously I personally don't agree with. And so this article also provides arguments for kind of counter arguments, including the fact that, for me, the biggest argument is we have to face the reality that mental health challenges. First of all, a lot of students are struggling with mental health, and that those same struggles are barriers for students' ability to learn. The metaphor I like to use is anxiety is like having an alarm going off in your head, and depression is like having a dark cloud in your head. Either way, whether you're having an alarm or you have dark cloud in your head, you can't, if you're sitting in class, no matter how great your teacher is, no matter how great the curriculum is, you're just not able to learn, you're not able to connect. Sarah's story that you so beautifully narrated is a great illustration of that. So if we're not screening students and if we're not addressing mental health, our students are not going to do well academically. We're going to fail them in the very mission of education.
That's a really good point, Shai. We're not going to have enough time to answer all of the questions, but we will be sending out answers to all of them after. So if you still have some questions and want to put them in, we'll actually send out the answers to every question that was asked. So that will be coming out to you after. But we have time for a little bit more. Let's see. So Elena had said that she's been reading about ISF. What do you think of the idea that simply referring to students to mental health services is not enough? Are you seeing any schools who are trying to do more tier 3 in-house by bringing mental health experts onto school teams?
I think it comes down to, issues of capacity, funding, and honestly, philosophy. Like we were just saying before, some schools feel like they just don't want to get into the business of mental health. The argument I would make is the MTSS argument, that it's important to have strong tier 1 support for all students. Helping students manage emotions, manage stress is important for all students. It's going to make them better learners. It's going to make them healthier. It's going to make them more successful after school, once they graduate from school. So that is part of the mission of education. So, and we can do that well. We as educators can integrate social emotional learning into our academic instruction and build those important skills, which would also reduce the need for mental health supports. Once you get to the tier 3 level, I think it's really important that we identify, diagnose, and support and provide the mental health services to students. how it's done, where it's done. I don't know if there is research. There might be research on what's more or less effective. But as long as that's being done, as long as students have access to mental health, to kind of high quality mental health, I think that I personally don't know how important it is that it's at school or outside of school.
Yeah, great. That makes a lot of sense. Thanks, Shai. Okay, so we are going to close down the Q&A, but if you still have questions, feel free to put them into the chat. We're going to start to wrap up. And to do so, I would like to mention a really exciting opportunity. Next slide. We have a school mental health community of practice that is beginning. And it is open to state and district leaders overseeing mental health initiatives, and potentially it could open up to others as well. But right now we're inviting state and district leaders who are involved with mental health. The community of practice will help participants identify and share best practices for implementing and supporting multi-tiered systems of support for SEL and mental health. So this was a little introduction to MTSS, and so we are going to be going deeper into sharing and identifying best practices, discussing challenges. It's going to take place through 1-hour virtual meetings beginning this fall, going through at least the spring. We'll have the meetings probably every other month to start. And so if you are interested, thank you so much already, Cynthia. I see you're putting your name in there. Go ahead and put your email in the chat. We will be sure to reach out to you if you do that. And we can, we'll advertise it in other ways too. So this isn't your only opportunity if you forget to put your email in the chat now. So thank you. Next. Okay, so lastly, we would love to get your feedback on today's event. This is our first of our REL contract this year. We're in year 1 of our 5-year contract, and so we want to know how we did with this event. And your feedback will help us improve. So we have a link, and I'm going to ask that my colleagues put the link into the chat so that you can start to take it now. We will also share this survey with you after the event. And lastly, we have our contact information if you would like to get in touch with any of us or visit our REL Northeastern Islands website. So again, thank you so much for your engagement and enthusiasm in today's webinar. We look forward to connecting with you in other ways in the future, and good luck this coming school year.